Um, what is your stand on non-medical teachers in medical education?
What do you mean to say? Non-medical teachers means? They are medical teachers.
You mean to say non-medical in the sense it is a non-MBBS but teaching to medical students?
Yes, but the course which these people have done is MSc, right?
Yes.
So the
MSc,
name of the course
MSc
is
and
MSc.
PhD in medical subject.
Yes, but it is MSc Medical Pharmacology or MSc Medical Biochemistry, right?
Yes, sir.
Yes,
Or
so
medical microbiology. No, what is your view about the reservation?
I don't feel that it is a non-medical course.
It is not a non-medical course.
It's a medical qualification, but you are not MBBS.
Yes, sir.
That's all. Yes.
So, does NMC or MCI should continue them in education, because there are so many policy changes have happened, like showing some bias over these non-MBBS qualified medical teachers.
The question you are asking me is a personal question, actually. Some person may have bias about medical teachers and some people may have bias.
Of course, as a professor and HOD of a pharmacology department, you can answer.
Yes, as a professor and HOD pharmacology department, if the person is a good teacher, then whether he is MSc or whether he is MBBS, it doesn't make a difference. If there is a difference, then probably there is some lag in the teaching. There is some deficiency in the teaching. These MSc people, when they are actually doing their MSc medical pharmacology and medical biochemistry, if their training is extensive and if their training is good and if the person is a good teacher, then this good teacher can deliver in an equal way. I have seen many MSc medical biochemistry or medical physiology and medical pharmacology teachers doing an excellent job. So that statistics again is same. There may be many MBBS medical teachers who are not good teachers. This also can happen. So basically, whether you are a good teacher or not, that matters. And have you acquired enough information and knowledge during your MSc course, and whether your training was extensive or not, that is going to decide.
So their competency will decide.
The competency will decide, basically.
Yes, sir. Another question is: have you done any work in medical education improvement? Like, have you worked for any guideline or any statutory body where you can make some policy guidelines for medical education?
No, I have not worked on any statutory body. Okay. I'm a medical education expert because I have completed all the required workshops and I have been conducting sessions for medical education technology and health science education technology at various colleges and universities. I'm also working as a faculty resource person for Maharashtra University of Health Sciences, Nashik.
FAMER or ACME, have you done in FAMER or ACME courses?
No, I have not been on these bodies.
Have you made any videos suggesting the improvement in medical education?
I have not done any videos on suggesting improvement in the medical education, but I have done the videos of my own subject teaching, that is pharmacology, and I have also done videos on behavioral science, okay, which is for undergraduates. And I also have my own website called MutalikPharmacology.com, where the students can basic undergraduate pharmacology learning can become easy for the students.
And it is freely available and freely accessible.
It is freely. The www.mutalikpharmacology.com is a free website, and throughout the world, almost from 50 countries, more than 50 countries, almost 20,000 users are using this website.
Okay. So another last question, sir. What is the major difference you have observed in the students from India and students in abroad, other countries other than India? Is there any gross difference that you have observed?
The gross difference which I have observed is the students who come to Indian medical colleges, they get admission at the age of 17 or 18.
Okay.
And they are very young students. Because they are very young students, the positive point of this is the energy level. Okay. That's the first important. But at the same time, I believe that with age your maturity increases and your responsibility increases. And because the Indian students are facing sort of more competition, and they've got more avenues for learning, more avenues for going for super specialty, as compared to the rest of the world, education in India, although we say private medical colleges are charging so heavily, but still the medical education in India is expensive. And that is why probably we want to get out early, we want to get out fast, and our curriculum has been designed in this way that you get admission for medical curriculum at the age of 17 or 18. Abroad, I have observed is age is no bar, and even a 25-year-old, 30-year-old also student also comes for medical learning, and there the person comes to take up a medical doctor course because he has got extreme passion for becoming a doctor. Here, as far as the intake criteria is concerned and the reasons for taking admission to a medical course is concerned, there may not be every time an extreme passion and extreme wish and will to become a doctor. It may not exist. And as teachers, you and me, we have been seeing that many students are forced into the medical curriculum for various reasons. So these are some basic differences. And there, because I've seen many students, they got admitted in the medical course at the age of 23, at the age of 30, at the age of 35. And because the person takes it up because he wants to take it himself, the people are more devoted and they've got more responsibility of working as compared to the Indian students. And it is very obvious that when you are 17, 18 or 19, naturally you are on the verge of your adulthood, and that is why, although we call adults, they are on the verge of adulthood, and that's why many times the teachers have to do a kind of spoon feeding type of a thing with students, and the teachers have complained that students don't do this, students don't do that. There I think if the age is more, the sense of responsibility is more. This is a sort of difference.
So, but you said medical education in India is expensive. Even in government colleges also you feel it is expensive?
Government college, see, it is very difficult to compare strata by strata as compared to the countries. But I am saying in general.
In general.
Mm.
Oh, it is. But many people are coming to India.
I didn't say expensive. I said it is less expensive.
It is less expensive. Okay.
Less expensive.
It is less expensive. Okay.
There, if you want to become a medical doctor, there is huge expenses.